Hey everybody, it's actually Thursday. Wednesday got a little away from me yesterday, and so we're going to do Wisdom Wednesday on Thursday this week. But I wanted to share some information. You all who've been with me and have listened to some of the things that we've talked about in the past and who are patients and been in the office know that I'm a big fan of the supplement Spermidine, which is a polyamine. And our particular product that we carry from Spermidine Life is a product that has been shown in many instances to have very favorable effects in many areas of our life, including improving autophagy, increasing energy, helping with hair growth, improving cardiac function, brain function, etc. There's just some real promising data out there in many areas of our overall health and wellness, but a new study has just recently come out showing that Spermidine is also very helpful for osteoarthritis. Now, several types of arthritis out there. There's osteoarthritis, which is what we would consider just aging arthritis, which we find a lot of stiff joints and associated with just wear and tear, so to speak. Can also be seen with just underlying bone changes and inflammation and different types of issues with just weight bearing. So overweight, being obese, can increase osteoarthritis, having genetic predisposition if your parents had it. And when we look at our hands, if you've had issues with the distal joints of the hands, those tend to be more related to osteoarthritis or wear and tear. The proximal joints here in our hands, if you have a lot of issues there and some of the misformation of hands that occur with aging, that is often associated with rheumatoid arthritis. And these are two different things, but associated with similar processes at the end of the day. But Spermidine has been shown to really halt some of the aspects of problematic degradation of the cartilage, which is that soft tissue that cushions our joints. And that's when you hear people talking about bone on bone, that is their cartilage has really worn down and there's not enough there. Well, it appears that the Spermidine has been shown in studies to really lower inflammation, but also help this degenerative process that happens with the joints and can reduce inflammation so that there's less synovitis, and so the synovial fluid that's in there is not inflammatory, can lower that. And it's just a wonderful thought that we have other opportunities that are not problematic in other areas of our body. For instance, we know we can eliminate some of the inflammation in the joint by putting steroids in there. Well, steroids do eliminate the inflammation, but also can be quite destructive. Whereas something like Spermidine, if we really start to see more and more studies come out showing that it actually slows degeneration, but maybe there's some interesting data coming out that it can sort of stimulate some of the stem cells in the area to become chondrocytes, which then help rebuild and restore cartilage, which we really haven't seen a lot of. Certainly we can do PRP and you can put stem cells in there, but this is an oral supplement that's readily available and has some real true possibilities as far as joint discomfort, joint health, and perhaps even regenerative processes that might be beneficial. Now, you know, we've talked a lot about Spermidine in the past for so many other things, but I just wanted to share this because this study just came out and it's just one more really wonderful way that this particular supplement has been shown to be of health benefit as well, not only from just feeling good, but keeping us perhaps away from having to do joint replacement and just being comfortable, being able to continue to move and be active in our world. So hopefully that's given you some insight into a new application for this. And any of you have been taking it, you may already sense that you have less discomfort in your joints because there is less inflammation. But just the knowledge that perhaps there's some regenerative aspect of this too that might be happening is quite exciting and reassuring, and allows us to think that this might be another treatment opportunity just for osteoarthritis and or even somewhat rheumatoid arthritis. You all have a great week. Sorry we're a day late, but I probably won't be here next week. I'll be out on the slopes again, so probably talk again in 2 weeks. Have a great week.